I am Rachel. I am a radiation therapist and clinical recruitment coordinator at SkinCure Oncology. So thank you all for joining our virtual career expo today. A little note, your microphones and cameras have been disabled, but you are welcome to ask any questions you may have in the Q&A tab. If that doesn't appear at the top of your screen, you'll be able to find it under those three dots labeled more. So I have Abby and Stephanie here today who they will be doing their best to answer all of the questions that come through there. And if you'd like to chat one-on-one with someone from our team, please let us know and we can get that arranged. Anyway, welcome. At SkinCure Oncology, we are very proud to be part of this stakeholder team of disruptors. We are changing the way things have been done for over 50 years. We are highlighting an incredible therapy combined with a comprehensive model to advocate for patients and thus giving them access to high quality treatments and the ability to make empowered and informed decisions about their treatment course. So in this session, you will learn about the latest advancements and techniques with image-guided superficial radiation therapy, that's IG-SRT, and the comprehensive solution provided by SkinCure Oncology. We will go over who SkinCure Oncology is, our mission and what we're about, and further what superficial radiation is, what diseases and conditions it applies to, and the big benefits from image utilization. We will also answer frequently asked questions about regulations, training, and treatments. So let's get started. So we refer to superficial radiation therapy as SRT. And when the machine has integrated ultrasound image guidance, it is IG-SRT. So this is the technology all of our radiation therapists are currently using in their practices, which is currently the SRT 100 Vision by Census Healthcare. So that is the model and the manufacturer, just like your TrueBeam is made by Varian or the Versa is made by Elekta. In IG-SRT, an ultrasound is set to a frequency of 22 megahertz, which is the optimal frequency for evaluating a skin layer with a depth of about 0 to 6 millimeters. So that's used to determine the extent of the lesion beyond the clinical visibility. That's a high-resolution dermal ultrasound, or HRDUS. So that's done prior to beam on, and it's used to assess and confirm our tumor configuration and location, and to detect the changes which may indicate a prescription change as necessary with our adaptive radiation therapy treatment planning. So that HRDUS is also performed during initial simulation for treatment planning purposes, as well as at the follow-up evaluation after the treatment course is completed to evaluate the response. So to touch on the basics, the high frequency portion of the electromagnetic spectrum is of course where we find our ionizing radiation, and that's what we utilize in radiation therapy to damage the DNA of cancer cells and disrupt their cell function. So with IG-SRT, we are treating with photons. We are using low-level X-rays, not low level like down there by microwaves. We are still in the X-ray portion of the spectrum, just on the longer side of those wavelengths. With this therapy, we are utilizing energies of 50, 70, and 100 kVp. And low-level X-rays are still ionizing radiation delivered at therapeutic doses, and it's important to adhere to safety protocols for optimal efficacy and safety for our patients. So just as new hires in a hospital are given mandatory radiation safety training, we ensure that everyone in the dermatology office who is involved in IG-SRT is safe by implementing a radiation safety program that meets both federal and state regulatory requirements. So each state is responsible for their licensure. We are currently in 42 states, and in the majority of those states, we will have one radiation therapist per treatment unit. Of course, any states requiring two radiation therapists, we will follow those regulations and have two therapists operating the technology. So we have a team that is committed to making sure everything we do is by the book and to the highest standard. And speaking of standards, recently the ASRT's annual Governance and House of Delegates meeting, the radiation therapy chapter approved a change to the ASRT's practice standards that now does include a standard to support radiation therapists who are treating with superficial energies under the supervision of a licensed practitioner, such as a dermatologist. Which brings up the most commonly asked question is, who is writing and supervising the treatment prescriptions for the course of care? Again, It will depend on the state's regulations, but radiation therapists are allowed to deliver treatments as prescribed and supervised by a dermatologist or qualified provider. We have multiple radiation oncologists providing general supervision, but dermatologists are licensed authorized users for superficial radiation treatments and have been providing superficial therapy for over 100 years. The goal is really to make sure whomever is prescribing, treating, and supervising is well educated, registered with the state, and can provide safe and effective care. So, even when working with lower energies, we are always limiting our exposure, doing everything we can to keep radiation exposure as low as reasonably achievable. Here you see the process of creating our treatment rooms. Remember, we are operating these machines in a dermatology office. We take a standard doctor's office exam room and create a shielded treatment vault. You'll notice our lead vaults don't require a maze or extremely thick walls made of concrete because we're shielding for much lower energies than a LINAC. So the shielding calculations are completed by our medical physics physicists and are based on the dose limits for occupationally exposed workers and members of the public. Our requirements are still regulated by the National Council on Radiation Protection and Measurement Guidelines and ALARA, of course. And our radiation therapists do still operate the machine from a console outside of the treatment room, which has interlocks that will require that door to be closed in order to beam on. Concisely, the treatment room is the setup to a cancer center environment. So let's get into what we treat with IG-SRT. Skin cancers are abnormal growths in the epidermis that can spread downward into the dermis. And the two main causes of skin cancers are going to be UV rays that can come from the sun or tanning beds and genetics. With IG-SRT, we treat early stages 0 to 3, high and low risk non-melanoma skin cancers, referring to skin cancers that are not melanomas, meaning they don't originate from melanocytes. So the most common type of skin cancers are the basal cell carcinoma and the squamous cell carcinoma. And basal cell carcinomas are the most common type of skin cancer. In this top left photo, the physician has designated the treatment field for a nodular basal cell in front of an ear. So we want to treat the clinical tumor as well as a margin around it. And the image to the right is the ultrasound. The black mass is in the image is the basal cell. A CT scan or an MRI would likely not give us the detail we need for planning a superficial treatment. These superficial simulations are done clinically, and the ultrasound is used to provide the depth, width, and breadth of that tumor for the physician to set up clinically, identify adequate and appropriate margins, and prescribe the appropriate course of care. And the best part is the ultrasound is integrated with the superficial unit and it's used to monitor the response of the skin cancer throughout the treatment. So as that skin cancer is destroyed, the area is repopulated with healthy tissue, which on the ultrasound appears as that green and yellow color. And patients also love to see the changes in their ultrasound. So, unlike a tumor within the body, this is on the patient's skin. More than likely, they are already able to see the progress with their own eyes, and that ultrasound is giving them added confirmation, which also increases patient compliance. And below, you can see another nodular basal cell. This one is by the patient's eye right here. This one really gives you an idea of how small these lesions can be and the importance of a clinical setup and how these low energy machines are able to eliminate a skin cancer in such a delicate area. And you can really start to appreciate why this has become such a preferred treatment by our patients. A squamous cell carcinoma, that is the second most common type of skin cancer. So here we have a lesion on the chest with no clinical markings and another one down here where the physician has designated that treatment field. Both sites have a clear black area on their ultrasound showing where that squamous cell carcinoma is. So since these are more likely to invade the tissue below, it's very important to confirm the depth, width, and breadth of the tumor at the time of the simulation, especially in cases where the patient may have waited an extended period of time before seeking treatment. And afterward, you can see these lesions are visibly gone at that follow-up appointment. The top one does still have a little bit of redness left, which is normal as that follow-up is typically done 4 to 6 weeks after the last treatment. But in both cases, though, the black area is no longer visible on the ultrasound and the healthy tissue has repopulated that area. In dermatology offices, we often encounter keloids that can be removed without having to put the patient under general anesthesia. Keloids are those raised, thick scars that expand beyond the initial injury to the skin. They can occur on a surgical scar or from any trauma to the skin, like a piercing, burn, or even from acne. And there is not a 100% cure rate for keloids, but with surgery alone, there is a 90% chance the keloid will regrow. So we use radiation to lower the chance of that recurrence. So once the keloid has been removed, a treatment plan is made and we use superficial doses of radiation to inhibit those overactive fibroblast cells that cause the keloid. Typically, the patient is treated for 3 days following the removal. And with IG-SRT, we currently hold a cure rate of about 90 to 95% for keloids. For non-melanoma skin cancers, IG-SRT has a over 99% cure rate. It is non-invasive and it provides stellar cosmetic outcomes, and it's conveniently done in the comfort of the dermatology office. So our patients are typically going to have a treatment prescription that involves them coming into the office 2 to 4 times a week for a total of about 20 fractions with customization options to each unique disease and desired outcome. That doesn't involve their first visit. They will have a simulation. The patient will have that clinical consult and simulation appointment in office where the physician determines the treatment field clinically. And during that simulation, we are going to use the ultrasound imaging to confirm the margins and that depth, width, and breadth of that treatment field. And like I said, depending on the state's regulations, the dermatologist can become authorized to plan and deliver superficial radiation in their practice. After the patient leaves, the prescriptions and treatment planning will be finalized, the custom lead shielding and dose calculations will be completed, and physics verifications will be done. The patient will be given their schedule and return at a later date for their first treatment. And the treatments are delivered a few times per week with an average of about 15 minutes per each treatment. So in this left photo here, we have a woman receiving IG-SRT for a skin cancer on her lower leg. She has a custom lead shield over the area that will protect the skin outside of that treatment field. So superficial units do not have MLCs. They have these cone applicators. So the cone is seen directly above this treatment area. This one here is the 10 cone. It has a diameter of 10 centimeters. The cone attaches that will be lowered to sit flush against that shield and the treatment field. So we don't set an SSD with an ODI here. Our cones have a fixed distance from where they attach to the machine head to the edge of that acrylic. So the 10 cone has an SSD of 25 centimeters. Over here on the right, you can see the skin cancer in the bowl of this patient's ear. So this is our smallest cone with a 1.5 centimeter cone. It has a fixed SSD of 15 centimeters. In treating with KV energies, we do our best to limit the amount of unnecessary scatter we create. So we use the appropriate cone sizes, of course, not too small as you would underdose the area, and not too large because you would be creating unnecessary scatter. Our patients are outfitted with protection, lead aprons, thyroid shields, lead-lined glasses, or lead eye sheet covers. And we are able to treat multiple lesions simultaneously during a single treatment course. So this patient here had 2 lesions on either side of his face. With IG-SRT, he had them both treated during the same appointment, with each delivery taking about 30 seconds. And you can see the huge improvement on the ultrasound and on the skin. Of course, some scarring is normal, especially when the lesion eroded the tissue prior to treatment, like by the ear. But you can just imagine how much tissue would have had to be removed if this had been done surgically. This patient had no downtime, no surgery, and no skin grafts. So it's really an amazing treatment option for patients and can really prevent some horrific experiences. And these superficial units have come a long way in terms of technology. The machine may be small, but it is equipped with a touch screen, an onboard computer and dosimetry system that provides lesion photos and patient records, including record and verify. and it has a two-way communication system built in. There are adjustable cone applicators, and once the correct cone is inserted into the treatment head, the machine will apply the correct copper or aluminum filter to match the selected energy and beam depth. So once you're ready to treat, the unit calculates and verifies proper dosing and measures each dose administered during treatment to ensure the patient's safety and optimal outcomes, as well as records and verifies all delivery information. And the technology has a rad check feature for morning warm-up quality assurances. That morning warm-up will automatically confirm the system calibration each time the system is initiated to ensure the patient is receiving the correct dose and eliminates the need for unscheduled calibrations. So while the machine will run through everything on its own, the RTT is still needed to confirm the outputs after the warm-up is complete and check the functionality of the safety features. Quality assurances and checks are reviewed by our medical physicists on a weekly basis. So the SRT 100 Vision is the machine, Census Healthcare is the manufacturer. So who is SkinCure Oncology? SkinCure Oncology comes from a radiation therapist named Stephen Scott. He was the first radiation therapist to deliver an IG-SRT treatment to a patient in 2015, and shortly after published a graduate thesis on on superficial radiation for the treatment of non-melanoma skin cancers. Stephen realized there was a large need for this treatment, but also recognized that not every dermatology office could afford the huge price tag that comes with the startup for a superficial radiation therapy program, especially one delivered at a cancer center standard. So SkinCure Oncology was created, and it works to partner with dermatology offices and give them everything they need to offer this treatment safely and effectively. SkinCure Oncology provides everything from the technology, the in-suite shielding, the lead shielding, all the way to the paper tape. But most importantly, when a dermatology office partners with SkinCure, they get access to the highly sought after industry leader and proven protocols and our incredible radiation therapists that are able to achieve that 99% cure rate and a 99% patient satisfaction. And the company is coming up on its 8th birthday, and there is currently 328 dermatology practices throughout the country that now offer this treatment to their patients, and we are continuing to grow. SkinCure's mission is to empower patients and dermatology practices by providing the highest level of education and expertise needed to deliver superior outcomes for non-melanoma skin cancers. And that is why it is so important that board certified radiation therapists are the ones delivering these treatments. Doesn't like my laser pointer. There we go. So here is a little glimpse of what IG-SRT looks like in the clinical setting and the role our radiation therapists play in the process. So our radiation therapists serve as the primary point of contact for all IG-SRT related matters within the dermatology office. The radiation therapist role can include duties such as speaking to the patient as early as the time of their biopsy and discussing pathology and treatment options with that patient. Our radiation therapist operates the ultrasound and acquires the initial images that allow the physician to prescribe the most appropriate energy for the skin lesion. Our clinical simulation looks a lot like an electron boost simulation. Our physician is going to come into the room, meet with the patient, and draw the margins for the treatment field. As in any simulation, our radiation therapist is going to do their best to document everything for the treatment, locating the field, and how to get the patient positioned the most comfortably in that nice padded reclining treatment chair. So once our patient has left, our radiation therapist will begin a process of getting all the documentation completed, uploaded, charted, and finalized for the patient to begin treatment. And when faced with any challenges, our radiation therapists are able to troubleshoot, but there is always someone they can reach out to for help. Our radiation therapists have access to supervising radiation therapists and colleagues, physics and technical support, weekly grand rounds for presenting difficult cases, and an online portal with relevant information and protocols. So when our patient returns for treatment, their treatment appointment time is going to be fairly quick, typically between 15 and 20-minute time slots. The patient will be set up for treatment with their lead shielding. The machine arm extends from the base and it has multiple adjustment points that will allow the radiation therapist to get that tip of the treatment cone on FOSS against that shield. And after the radiation therapist can make those fine adjustments, and once everything is perfect, lock the machine into place. After everything is positioned, a radiation therapist will leave the room, closing that lead line door behind them, and operate their superficial unit from their console outside of the treatment room. So our key to success is hiring board certified radiation therapists. This is an elite position in a disruptive field, and it's offering an opportunity to work with a groundbreaking technology like IG-SRT and an industry leader continuing to advance care for bettering medicine. So working with IG-SRT not only enhances your education and knowledge, but also places you at the forefront of medical innovation. There is a lot of responsibility in this role, but the rewards are well worth it. And at SkinCure, our radiation therapists are making a difference every day. We are setting industry standards with the highest expectations. And our radiation therapists hold themselves to those high standards and are continually striving for excellence. And we have the greatest support staff that makes that excellence achievable. So even though you may be the only radiation therapist on a site, you are not alone with SkinCure Oncology. We have radiation oncologists, supervising radiation therapists, weekly grand rounds for difficult cases, a full physics team, clinical training resources, and even continuing education credits. So, how much experience do you need for a job at SkinCure? Experience is not required. Of course, you have to have your ARRT board certification and any necessary state licensing, but we handle the training. So, SkinCure has a multi phase training curated by radiation therapists for radiation therapists. And our new hires training starts with an online learning to establish the basics. So, then they will complete a comprehensive week-long training program with a knowledgeable radiation therapist known as a clinical training specialist. And after they do that, it's time to transition into the new office. And it's best done by overlapping with the current therapist or an implementation specialist who is also a radiation therapist. And to maintain the cutting edge proficiency, radiation therapists undergo continuous training throughout their employment. So, this includes staying up to date on our technological advances, protocol updates, and guidance from peer and experts. So, this is made possible with training modules and support tailored to the level of experience of the radiation therapist and the dermatology practice. And we can't forget additional opportunities such as a trip to a corporate office for in-person group training, weekly grand rounds with radiation therapists from across the country and expert physicians, and those monthly CE educational presentations. But we don't just stop at educating radiation therapists. There is also a complete site dedicated to patient education called GentleCure. So, GentleCure is what the patients and consumers call this therapy. And the GentleCure experience is a standard of care only provided by SkinCure Oncology radiation therapists. So, we strive for the highest level of quality through the implementation of a cancer center model within the dermatology office. So on the GentleCure website, we teach full, balanced, informed consent, meaning the patient is educated on all treatment options prior to making a decision. We want them to feel empowered. We want them to make the decision that is best for them. So they have access to information about skin cancers, testimonials from real patients, and even phone numbers to call and talk to someone who can help explain things or point them in the direction of a nearby clinic. It's a really great site to learn about skin cancers from a patient's perspective or share with somebody who may be struggling with skin cancers. And speaking of finding practices, we offer positions for full time, part time, PRN, and traveling radiation therapists across the country. Our open positions are updated frequently, and you can apply online at indeed.com to any of our open positions or reach out to the recruitment team at our email address recruitment@skincureoncology.com. But that's what we are doing here at SkinCure Oncology. We are disrupting and providing the highest quality of care to our patients and leading the industry in making medicine better. So, thank you for joining us today. If you would like to set up a time to talk to one of our team members, please reach out to us at recruitment@skincureoncology.com. And if we weren't able to get to your question during the session, we will have somebody reach out to you. And for anybody attending the ASRT's Radiation Therapy Conference in Washington, D.C., you can also find us there in the exhibit hall at booth number 52. Before you go, we did have a quick little poll just to kind of gauge how we're doing. This is a first time event, so any feedback is welcomed and appreciated. But thank you all again. I hope you have a great night.